in terms of prevention of stroke, the most important thing is to try to diminish your risk of atherosclerosis. Probably the single most serious treatable cause of stroke or atherosclerosis is high blood pressure. People frequently ignore their blood pressure even though it's high because they don't have any symptoms, so that the doctor tells them your blood pressure is high and they say, well, I don't really feel anything. You may not feel anything, but that pressure hitting all the arteries in your brain and in your heart day after day causes irregular narrowing of the arteries from the trauma to the arteries. So controlling blood pressure is very important for patients, even if they don't feel symptoms. Smoking is another cause of atherosclerosis. So you think of smoking as a risk factor for lung cancer and other diseases, but smoking causes tremendous damage to all the blood vessels in the body. So it's very important to control or to stop your smoking. Diabetes is another not preventable, but treatable cause of atherosclerosis. Even if you don't feel anything, you have to listen to your doctor, control your sugar as best you can with your diet modification, taking your insulin or taking whatever medications you can. In some cases, there's family history, so you can prevent it in a different way. If you know your mother or your father died of a ruptured aneurysm, that kind of a stroke, there are ways that you can see if you yourself can be screened for that condition, because you want to know if you have an aneurysm. You may not have a stroke, but you have an aneurysm, well, you're going to be at a risk for a rupture of that aneurysm and a stroke in the future.